When we transitioned from being a major regional hospital to being a much larger tertiary referral centre, one of the potential risks was that we would lose that small hospital feel. One of the aims of the OneED wellness program is to try and retain that connectedness with each other, because connectedness should enhance our attributes of empathy, compassion and communication, and all of these should then lead to enhanced patient care delivery.
The OneED program was introduced in a busy emergency department with a rather chaotic workplace where you can't plan your day. The message that I've always believed, if the staff look out and look after each other, they'll look after the patients better. But in this stressful environment, it's very important that the staff, through mindfulness and through other things that are provided, actually go to work in a calm and relaxed manner and feel safe and comfortable in their workplace with their colleagues and therefore with their patients. And as part of that teamwork, the more we can instill those values of having a horizontally managed OneED where everyone looks out for everyone else, the better patient care results.
The wellness program has made a significant difference to me because it has reminded me to take a moment out of the busyness of the emergency department, reflect on how I'm doing and how my staff are doing and how the patient is doing.
I think the emergency department in itself is a really dynamic, fast-changing and stressful environment, and people can find themselves very overwhelmed with multiple tasks happening at the same time. So I think mindfulness gives the clinicians, whether they're allied health or doctors or nursing staff, the ability to just take maybe 2 minutes out of their day to be a little bit more centred and more task orientated so they don't get that feeling of being completely overwhelmed.
The OneED wellness program has really helped nurses develop skills that are invaluable in our profession. It helps us develop empathy, compassion, stronger listening skills.
The OneED wellness program has kind of given admin staff a tool to really help in their work. While our daily tasks may not affect patient care, people we help, their actions do directly impact patient care. Because they're under a lot of stress and a lot of pressure, when they do come to us tired or stressed out, it might come across as a bit direct, and it just allows us to kind of step back and look at why they might be that way, and it really helps us provide them with the best support.
So with respect to what it might mean for our patients, I think that it helps us to moderate the stress levels in the department. We run on adrenaline in the emergency department, and giving us a moment to check means that we are better doctors. We are more mindful of how our patients are travelling as well.
The program's personally been amazing. It's changed my perspective. I come into work with a real positive energy.
The outcomes that I think we see is that we see staff quite prepared to firstly undertake it, which is a difficult thing, and secondly, I think that in a place like this where nursing staff and medical staff and admin staff and porterage and allied health and everyone works so closely together, I think that we see that a strengthening of what were strong relationships, bonding even better.
For us, the OneED wellness program and the mindfulness practice within it is not about the destination, but it's about the journey and the process that will get us to where we need and want to be, more effective at our jobs and more effective at our personal lives.